I told my son, I can't go to dinner with you. I'm just feeling really tired. And then I hit a wall. That night, I had a fever of 101 at 1 o'clock in the morning and chills. So I got some extra blankets on. At 5 a.m., I checked my temperature. It was 104.5. And I said to my wife, this is not a cold. About a day later, they said, it's COVID. That was the beginning of my grand adventure. My name is Neal Murphy, and I had COVID in March 2020. They said, let's consider the worst possible scenario. And I was immediately isolated from the other patients. I was very, very sick. They put a cannula, which is a little plastic tube in my nose, and gave me oxygen. When the diagnosis of COVID was made, they immediately isolated me even more strictly. They took me to a different ward. And then I wasn't responding to the oxygen. I needed increasingly higher amounts of oxygen through the nasal cannula, and it wasn't happening. They came to me and said, we may have to intubate you, and that's a serious step. After they counseled me, after they had the chaplain come in, and I said, what are my chances of never coming out of it? They said, well, about 50-50. As it turns out, it was about 3% chance of surviving because of my comorbidities. And I said, well, I'd beat odds like that. That's no problem. So I put that picture of Senator John McCain when he was a POW in Vietnam on my bed railing, and I focused on that. And said, if he can survive 5 years of torture, I can go through this. So I played Wagner's Ride of the Valkyrie and looked up and said, do it. And that's the last thing I remembered.
We talk about this a lot in medicine about an organ failing, right? So you have kidney failure, liver failure. I mean, when you're intubated, that's like lung failure, right? Your lungs can't work on their own anymore. And as a very kind of philosophical kind of guy, he can try and view the situation somewhat objectively and realize that, in his situation there was nothing he could do. So either he's going to survive or he's not. He was able to kind of recognize that and say, okay, let's go along for the ride. Let's see what happens.
I did get into trouble a little bit, though. I felt that I wasn't being physically fit, so I got out of bed and started doing some push-ups. Well, that immediately set off all sorts of alarms, and nurses rushed in and said, get back in the bed. This is not a gymnasium, dummy. Get in there. So I said, yes, ma'am. And then I behaved myself after that. It was sort of a stupid thing to do.
He's all about the fight, the struggle, never give up, never surrender. That's his ethos.
I wasn't scared. I'm 75 years old, so I've been around the block a few times. There's a point where you have to say, I could do no more. The human compassion was laudable and palpable, and I felt very reassured. I'm certainly grateful. Miracles are helped along by the dedicated people that are in healthcare. That cannot be denied. They really are heroes. I would be a dead man without them.